This is INCRadio, DCEM 954, the voice of truth, the official radio station of the Church of Christ or Iglesia ni Cristo.
Welcome to INC Radio Oregon, where our brethren from different parts of Oregon, Washington, California, Idaho, Montana, and Wyoming greet you. Come get to know all of our brethren from the Ecclesiastical District of Oregon and explore our activities, experiences, and sceneries. This is Oregon.
INC Radio Oregon. Thank you for sharing your precious time, and I hope you enjoy our topic and our discussion today. I am your host, Geraldine Langit, from the local congregation of Vancouver, here in the Ecclesiastical District of Oregon. And before I continue, I would like to greet our resident minister, Brother Jake Cruz, and his family, as well as all of the brethren in the local congregation of Vancouver and all the brethren in the District of Oregon. And we eagerly await your participation in our live chat where you can share your thoughts, questions, and insights on our topic and discussions today. And we hope you enjoy it and stay with us throughout our broadcast today. And if you have any questions, please don't hesitate to ask us in the live chat, and we will do our best to answer them. So, for our topic today, it is the advantages of a medical health plan. And we all know that life happens, and one of them is the possible high medical expenses of an unexpected hospital visit to the emergency room. So without medical health insurance, it could easily drain your savings or place you in debt. And we don't want that. And so if we are employed, there is no reason why we should not take advantage of this benefit. And we will discuss that why this should be a top priority. And just a disclaimer, this is not a sales pitch, but only for all of us to gain knowledge about medical health plan, medical insurance with our resource person, which is Flo Guillermo. Hi, Flo. Thank you again for joining us.
Hi, Geraldine, and hello, everyone joining us here on INC Radio Oregon. And um, just letting you know, all of you that's joining us today, our topic title is The Advantages of a Medical Health Plan. And so, right now, they're just changing up our topic border there. So, please bear with us, but we love that you're here today. And so, just letting all of you know that uh, last week we had our topic discussion in regards to the different terminologies in the medical plan insurance, and so we're gonna take it one level up and talk about medical health plan insurance with all of you today. And like again, Sister Geraldine mentioned, this is I'm not selling anything or just helping you all to be a little bit more in depth of the our medical insurance that we have, and just gonna be speaking from um, work experience because I've been in the medical field, more on the administrative side, doing claims processing for over 16 years. And prior to that, I was in the accounting department as well for our medical industry for 15 years before that. So, quite a bit of in- experience there. So, I'm going to toss this over to Sister Geraldine or Geraldine here with us, and we're going to talk about this.
Yes, thank you, Flo. I'm very excited to learn more about this medical health plan because I know for our last week's show, I learned a lot To be honest, like listening to your show with Sister Jillian last week, I would definitely watch that again just to know more of the medical terms. But for our topic today, why is it important to have medical health plan insurance from your employer? Can we not just have it?
Well, actually, uh, almost all of the employers do offer this benefit to their employees. Um, it is something that it's offered during open enrollment or at the time that you are hired for their company. So basically, it provides financial protection and it reduces the stress, especially when you have unexpected medical costs. And we all fully know that medical expenses could be way out of our reach sometimes, where it could be more than what we think it is, or we're not ready for it. So having a health plan is a good thing for all of us. It helps cover for these doctor visits, hospital stays, and just to let you know, even just 1 day of hospital um, inpatient stay could be very expensive. I see these claims every day, all day. And so I know what's that like. Also, prescription drugs, they can be very expensive as well. Another point is it is also a tax advantage. Your share of the premium is pre tax by reducing your taxable income. So it happens um, when you're getting paid on payroll. So it's already predetermined at that time when open enrollment came and you chose what plan you were planning to get. Also, it gives you the chance to have access to medical services. It helps employees to stay healthy, to prevent potential serious illnesses, um, and having this access to medical coverage. It's so important because even if you don't have medical insurance and you have access, it it's very, very expensive. Uh, so just be sure that the you have this medical plan that you're entitled to. I just wanted to point out to the moms and dads out there who have children. Your child, no matter if they're working or they're still in school, they're covered until the age of 26. When they hit their 26th birthday, they they get dropped off of your medical plan automatically at the end of that birth month, and then that's when your child needs to either be working and have medical plan or find other means of getting a medical plan for themselves.
Those are really good points. Thank you for sharing those. Just I guess I have a couple questions regarding that. You mentioned about open enrollment when you start a job. Just to clarify, is the open enrollment just a one-time thing, or like let's for example, I'm working at a company for 15 years now. Is there only one time that I get to enroll for a healthcare insurance, or is it like a yearly thing? Um,
Very good question, Geraldine. It is a yearly thing. Most companies have their open enrollment in the month of October or November, depending on when they're preparing for their medical insurance for the following year. So so basically, just be on the lookout for that. Your employer should be um, sending out either messages through your email, them know, letting all of you know that open enrollment will be upon us at very soon. So, and that's when they'll give you an open window of time when to choose your medical insurance and other um, other benefits that you're entitled to. So it's every year, and it's important to pay attention to that only because things can change from year to year. So maybe if a mom and dad parents have another child, actually that's actually a life event when you have a new child. No matter what part of the year you have them, you need to make sure that they're enrolled.
Sounds good. I think that's really good point to mention, Sister Flo. And also one more question I have with that. I guess it's just out of curiosity. So I know I'm under my parents, my mom's insurance right now, and I'm 21 years old. And let's say there's another Geraldine who's also 21 years old. Would the insurance coverage be higher, and then my mom would be paying more for insurance, or how is that? Kind of like same thing when you said if your child turns 26, they get automatically kind of like dropped from your insurance. Would your insurance then lower, become cheaper, or would it still be the same?
I believe you're probably referring to um the premium, right? For that year. No, that will stay the same. So a family coverage, there's like an amount that is slated just for family, and then if if you're just single, then that's just for that person only. So they have the family coverage, and then if you're just one person, it's they have a set rate for that.
Mhm. Oh, that's good to know. Thank you for that, Flo. Okay, so yeah, knowing all this, we kind of learned the importance of having this health plan. Does it change your perspective on seeing a doctor or seeing medical advice when you get sick or stay healthy?
Oh yes, most definitely. When you have medical plan, you're a lot more confident and say, okay, I can go to the doctor. You prioritize your health care by seeking preventive care, making sure you have the routine checkups, um, rather than worrying about the financial cost. uh, I would say prioritize your health, and then financially you could figure out that part. So it really depends on what your plan is, if you have um, co-pay, co-insurance, and deductible. And we covered that in the last um, show that we had. So, but I would say when you have the access to a medical plan, uh, you would prioritize taking care of you versus the financial cost. Um, I know that's something in the back of our minds, how much things can um, be costing you. However, let's bounce back to what your plan is really talking about, how much it'll cost you. And so it's good to study what they're offering you in that particular plan.
Right, yeah.
Also, okay, one more, a couple more points before I take your question, Sister Geraldine. So when you do have medical plan, early detection is important because it increases the chances of getting the medical care you need in a timely manner. So again, the confidence of having a medical plan and going to the doctor and making sure that you get the care that you need, especially when maybe something that feels a little bit off. And so getting that early detection is so important. There's instances where we are afraid to seek proper care because of what we're going to find out. Um, it could be the worst. But if you have this, like I said, if you have this and you go to the doctor and take the care that you need by doing your preventive checks, your routine checks, that is so key to staying healthy. Because when you do see the doctor, they'll find ways to help you either keep you from having it be escalated, right? Any kind of illnesses.
Yeah, that's a really good answer, Flo. Thank you for letting us know about that. And I guess just to add to that as well, we were mentioning about us paying like our insurance, it gets deducted from our paycheck. So basically, knowing that we have our medical health plan, we know that's our money as well. So knowing that we have that, and like what you said, we'll feel more confident. We'll be less worried about the financial cost it'll take after a visit. So now, how do individuals or like family members save money with health insurance, but since like they're paying more every like paycheck, how would that be?
Okay. So I wanted to note there that so your employer takes a portion of your premium and they pay it. That's a good benefit. And then you have a portion too. So that's your share. So that way you have a vested interest in yourself to make sure, hey, you know what? I'm paying this premium. I might as well go use them because if you don't, you're already lost lost money in terms of that. Um, like I always tell Brother Jess, take it to the maximum of using your medical insurance. You have no reason to continue being ill if you have medical insurance. So that's an advice I tell everyone is make use of it. So going back to your question is choose your plans wisely. So it's important to take a look at what the different plans your employer is offering because it does make a difference on what you're spending your monies on for your premium, what your co-pays, co-pays, co-insurance, and deductibles. So there's different plans. Two of them that we covered last week is the HMO plans, which is called the Health Maintenance Organization HMO plans, or the PPO plans, which is Preferred Provider Organization. So they have some differences there. So make sure you take a look into that. If you have any questions, feel free to reach out to us. We'll help you uh, look at that and maybe clarify some of that. Also, there's another plan that I did not mention last week was higher deductible, lower premium. So there's a plan like that as well. So the deductible meaning that let's say your deductible is $1,500 for that year, and so you need to be using your plan up and paying out of pocket expenses up to 1,500. When you hit that mark of 1,500 of out of pocket expenses, your insurance plan will kick in and they will take care of the rest no matter how much medical services you're taking on or using. So that's another one. Those so three plans, there's others as well. So make sure you choose your plans wisely as well. So make sure you choose your plans wisely. Another one is health insurance, or I'm sorry, health savings account, also known as HSA. And another one is flexible savings account. It's FSA for short. These help you or allows you to set aside monies um, for qualified medical expenses. And so these are pre-tax as well. So that's another savings also. So these you can this HSA or FSA, when open enrollment comes and you say you're thinking, okay, next year I think I'm going to be spending $1,500 in medical, dental, and vision expenses. Those are saved for using it for to pay for your copay, to pay for deductibles that you're responsible for. That way, it helps. you have a peace of mind that, hey, I have money to pay for this. I shouldn't be worrying about going to see the doctor. Okay. So that's another point also to be saving money. Also, follow up preventive care. I mentioned that earlier. When you do go have your screenings done, your checkups, your immunization, those are preventive care. That way, you can take care of yourself so that it won't let's say especially like maybe you took your vaccines and maybe chicken pox, and maybe chicken pox was on the rise, and if you have that immunization, maybe your illness may not take that long to recover. So things like that, taking care of yourself in the early part before it gets worse. So what they say, preventive care, there's a saying to that when you're taking care of yourself, preventive care. If anybody knows that saying, when you do take care of yourself, preventive care goes a long way. Use in-network providers. It helps you to minimize your out-of-pocket costs because these providers has like a contract with the health plan that you have. So it's pretty much like uh, controlled rates that they will charge for a medical service. And one of them, and then next, another point is having a healthy lifestyle um, now prevents future costly treatments and procedures. So we're young. For you, Geraldine, you're very young. Take care of yourself. Don't take it for granted because you know what? You're gonna later on you're gonna hear yourself, "Owie, ouch, ouch," you know? And it's very common. We say that quite often. And so take care of yourself while you can, while you're strong.
Yes, I think your last point was the one that a lot of people would want to do now because having a healthy lifestyle, we won't have to I guess stress too much about, financial stuff and um being afraid of going to the doctor because you won't need it if you are healthy. But again, knowing our medical health plan, all of our benefits for working at a company and stuff like that is really helpful to ease our minds, and stuff like that. And so, next question, Flo. What kind of services do most medical health plans cover, and what are the other plans that some medical health plan covers? So, like, not all medical health plan have it.
Yeah. So this is a short list of services that your medical health plan covers. And you can avail this yourself on your medical health plan coverage. So, doctor visits, preventive care, hospitalization, emergency care, medication, laboratory tests, and imaging. There's certain things, medical services that your health plan don't cover, such as those cosmetic surgeries. Those are not they're called non-elective procedures. Anything that is, I guess, out of the ordinary, having cosmetic surgery, um, they're not covered. It's somewhat listed in your health plan. Like I said, this is just a tidbit of it. So uh, just something that we can look into. But like I said, it's always good to go back and look at what your health plan says. Also, I just wanted to point out that if you have any questions about your health plan, make sure that you call your customer service. There's a customer service line on your medical card, and just ask them, "Hey, is this doctor in network, out of network? Is this particular service covered?" Uh, and such questions like that. They are more than knowledgeable to share with you um, that information.
Yes, those are really good examples, Flo. I know some of those on the list. I only know dental and vision care because as you can see, I have my glasses here, so I've used that from my mom, and also I used to have braces, and I can say it really helped. It really did help a lot. Having that medical insurance from my mom, helped me lessen the cost of out of pocket, and so yeah, use that to your benefit and like to the max. Um,
Yes.
so yes, now, so not everyone.
Before we go on to that, Geraldine, there's a question here. If we don't use our medical insurance, do we get a refund from um, paying of our premium? Just letting you know, you don't get a refund if you don't use your medical insurance, and uh, even if you paid it already through your payroll, so you don't get a refund. So like I said, you're actually losing money by not using your medical plan. So make sure you use it even when you're healthy. Like I said, I cannot emphasize this enough. Even when you're healthy, use it.
Yes. So for those who are watching, if needed, let's all use our medical health plans. And so, unfortunately, Flo, not everyone knows about medical financial assistance. So, could you please tell us more about this benefit that it offers to the patients or like the people that have it?
Yeah. Okay. Um, the medical financial assistance is uh, mentioned to you, especially when you go in for a service, like an emergency care, because the out of pocket could be very high, or a surgery or a hospital stay. So, not everyone is aware about medical financial assistance. So, I'm going to share that with you. Almost all hospitals have this medical financial assistance program. This program is very, very helpful to those who encounter large medical bills. And uh, and I know we have all the intentions to pay these bills. These are our financial obligations, right? But it can be, again, another stress level. So that makes you worry about all of these financial obligations. So take advantage of this, especially when it gets to a point where you cannot handle the your medical bill. You can inquire through their business office, um, or you can ask your physician, is there any way that I could get financial assistance? Uh, they have different ways on how you can pay your medical bills. They'll such as offering to pay the bill up front with a discount. You can say, okay, my bill is $500, but I only can pay this. Would you mind offering a discount? So you can negotiate it, and more than likely, I've seen this happen, and they will work with you on that. Also, there's a payment plan as well. It's an agreed upon plan where you pay X amount of dollars over an agreed amount of time. So let's say, oh, I I have 6 months. I can offer you 6 months at this amount. So, and then you pay it through an automatic deduction from your account. So, um, there's ways to do this, and it's just helping you to kind of level off the stress of all these medical costs that you could possibly encounter, because it does happen. So like I said, call the hospital billing department, their business office, and ask them about it. I've experienced this, helping family members and some friends to go through this, and and I'm able to get in contact with those who are in charge, and then link them up together so that way they can get take advantage of this. Also, just letting you know, they will also determine your application as well of your eligibility, proof of income. They'll ask you for that. Once they see that, they'll make their decision because their goal is to help you out.
Yes, that's a really good point, Flo. Thank you for mentioning that to our show today. It just reminded me of this show that I watched a long time ago. It's like a healthcare show, and that when a patient, for example, couldn't pay for their surgery bill, um, the hospital would help them pay for it, or would go all these like steps to help them pay for their bill. And it's good to know that we also have that in real life, and that everyone can also ask the hospital and stuff like that, like what you said, mentioned, Flo. And so that's good to mention because I did not know about that. I thought that was just a reality or like a show kind of thing. But yes, so yeah, so we've gone to our last little bits of our show today, but our takeaway for our show is medical health plan insurance coverage provides peace of mind, like what we mentioned earlier, and financial stability to care for us and our family members. And we can access medical services for preventative care, unexpected health crisis, and to maintain healthy lifestyle. But more importantly, for us members of the Church of Christ, knowing all of this, medical health insurance, having, I guess, like someone to help us with our medical bills is a good thing. But most importantly, we know our Almighty God is there to help us, is our number one healer. So if we ever get sick, what the first thing we do is pray to our Almighty God and ask for good health, for more strength, so we can continue our services to Him and continue to perform our duties. So, yes, thank you so much, Flo, for giving your insight in our show today and giving your experience, sharing your experience with us. Yes,
Um,
anything else?
Geraldine, I'd like to, add that for we know just even just surface level in terms of our medical plan. However, I'd like to just let everyone know, just be updated with these uh, these medical health plan, because it is for us, and we're fortunate that we have employers that offer these kind of benefits to us. So be sure to always stay knowledgeable, be on top of it, and also um, use it for ourselves, because we, like Geraldine said, we use ourselves as uh, to perform all our duties.
Yes, thank you so much, Flo, again. We really, really appreciate your insight on this. And so now we're going to read our live chat comments. And looks like our first place today is Sister Arnie Jane D from Lethbridge, Canada. Thank you so much for joining. And then we also have our sister Melissa Yaneza saying hi, Brother Albertson Macalintal saying good afternoon to everyone, and Brother Romel Arlos from Hillsborough. And then we also have greetings from our brother Rod Christopher Reyes, the resident minister of Portland, and Sister Annalisa Pimentel from Reading GW or Roseburg GWS. And then we also have our Sister Maria Dasmariñas. Happy weekend and happy viewing po to all brethren. Greetings from Dasmariñas family. And then we also have our Sister Danielle Macalintal, our brother Glenn Bernuevo saying good day to all, and our Sister Rachel Cruz from Beaverton. Thank you all so much, Paul, from joining us. And then we also have our sister Claire. Happy Saturday. And then from Brother Mario Oka from the local of Brixtonville, district of Caloocan North. And then we also have our sister Priscilla Batan saying hi to all the brethren from Rizal. And then we have a lot more. So thank you all so much for sending us your greetings and saying hi to us and showing your support in our show for today. So now for our greetings, we have some birthdays, some anniversary. First we'll go to our birthdays. Our brother Elix Ruben Romilo, the youngest child of our assistant district minister. His birthday is today, April 19th. So happy birthday, brother Elix. And then we also have our brother John Dave Escano, um, an assistant resident minister of Portland. And tomorrow is his birthday, April 20th. So happy advanced birthday po. And also Sister Lauren Blodgett from Beaverton will also have her birthday tomorrow, April. Happy birthday! And then we also have our Sister Luisa Ledesma on April 21st, Brother Gabriel Villanueva April 22nd, Brother Art Morales on April 25, and then Brother Mark Villanueva on April 25 as well. Well, we have a lot of birthdays this month. So happy birthday to all of you po. And then for our wedding anniversary, on April 23rd, we have our brother Warren and sister Elaine Maneja, the resident minister of Portland, and they're having their wedding anniversary. And then on April 25th, brother Fernan and sister Felma Tobiera will also have their wedding anniversary. So happy wedding anniversary po. And so now we'll go to our district activities. And we have a video today. Kuya Tex, if you can show the local congregation of Vancouver, CWS Tagisan ng Talino, that was held on April 13. So if we can show that po.
Congregation of Vancouver held a children's worship service activity called Tagisan ng Talino, where our young brother and sisters showcased their knowledge about the teachings and words of God written in the Bible. This activity was truly a success with the help of our Almighty God.
All right. Thank you so much, Paul, for that, Kuya Tex, and congratulations to our young brothers and sisters for that. And then the local congregation of Hillsborough will have their health awareness activity on April 27th at the place of worship activity area. And they will also have their nature walk at the Wooden Shoe Tulip Farm on April 26, 2025. So that is next week. And the local congregation of Portland will also have their nature walk on April 26, 2025 at Hoyt Arboretum. And so please contact your leadership to ask for more details about those activities. All right, so now we're on to our last bits of our show today. And we would like to say a special acknowledgement to our brother Eduardo V. Manalo, our executive minister, and our brother Angelo Eranio V. Manalo, our CFO coordinator, CEBSI CEO, and president. And we would like to thank you all so much, Paul, for your support and love for our INC radio here in the District of Oregon. And then we also have our brother Wally Taray, our INC radio station manager. And thank you to everyone who joined today on INC Radio Oregon, especially our district minister, Brother Moises Cadesale, and our assistant district minister, Brother Gino Ramilo. And join us again next week. We have another exciting topic, which is the value of taking initiative and embracing our responsibilities together. And so, again, we would like to thank our sister Flo for being with us here today. And so, after watching this episode, please share the program link with your friends and family. And let's all subscribe to INC Radio DZEM 954 on YouTube. And we'll see you all next week on our INC Radio Oregon. Thank you, everyone.